name is the ANUAR, matrix number 066421. This is the introduction of this topic. So, before we go deep into the topic, we must know what is zoonosis. Zoonosis in general terms are diseases that can be transmitted from animal to people and vice versa. So, that can be direct transmission like skin or inhalation or ingestion, or it can be done indirectly through this like bacteria, fomites, and the environment contamination. So, think about bacteria that is in indirect transmission. Bacteria known as a vessel that can pass disease from one thing to another. A bacteria not typically otherwise affected by the disease that carries but it transmits the disease. And you may be familiar with the term vector-borne disease. And these are diseases that are perpetuated by insect biological factors like mosquitoes, ticks, and fleas that can be carried disease and spread them between animals and animals, or between animals and people, and also between people from person to person with these biological factors. Although they are not harmed by the disease, they do play a role in terms of the disease. Why we should care about the companion animal zoonosis? And this is because of a concept that is now popularly referred to as a One Health, which is an integrated, unifying approach to balance and optimize the health of people, animals, and the environment. This concept is trying to say is that we can no longer view disease in silos, so human health, animal health, and environment health, and also the health of our ecosystem are all inevitable, connected, and we need to approach how we rescue disease events with a One Health lens. Companion animals, known as those animals who share our homes and lives that call as pets, like dogs and cats, horses, exotic animals, and also livestock can be pets too. But pets animals, particularly dogs and cats, play an important role in societies throughout the world. They are important companions in many households, contributing to the physical, social, and emotional development of children and the well-being of their owners, in particularly elderly people. Furthermore, pet owners are reported to visit their doctor less often, use fewer medications, and have lower blood pressure and cholesterol levels that non-pet owners have. Although pets offer significant benefits to our society, there are well-documented health hazards associated with owning a pet. Animal bites and allergy to pets are the commonest health hazards. However, a diverse range of infections, including parasitic, bacterial, fungal, and viral disease, are capable of being transmitted to humans.
Assalamualaikum and greetings. My name is FARHANA with SHUKUR with a matric number 066195. I will present to you about what is companion animal zoonosis. So what is companion animal zoonosis? Companion animal zoonosis is disease that can be transmitted between animals, which is pets and humans. Companion animal zoonosis can be classified into 4 phases, such as viral, bacterial, parasitic, and mycotic or unconventional prion. Next, example for companion animal zoonosis are rabies that common in dogs, sporotrichosis, which is sporo that common in cats, and salmonellosis that common in exotic pets, and others. So I will tell you a short story about rabies. Rabies is a preventable viral disease that most often transmitted through the bite of rabid animals. The rabies virus with a distinct body shape is from other monogonal that are classified in the Rhabdoviridae family, which includes at least 3 genera of animal viruses, which is lysovirus, ethomorovirus, and vesiculovirus. The genus lysovirus includes rabies bat, Lagos bat, Monocular virus, and Australian bat virus. Furthermore, rabies affected only mammals that are warm-blooded animals with fur. Although the rabies is common in dogs, this disease can also infect in cats. So how can you tell if an animal has rabies? We can't tell if an animal has rabies by just take a look at it. The only way to know for sure if an animal or a person has rabies is to perform laboratory testing. However, animals with rabies may act strangely. Some may be aggressive and try to bite you or other animals, or they may drool more than normal. But not all animals with rabies have signs like that. Other animals may act timid, move slowly, or let you get close to them, because that's not the way wild animals usually. You should remember that something could be wrong. Some animals might not seem sick. Leave wild animals alone, even young animals, for the benefit of the animals, your pets, and yourself. The most economical strategy to eradicate rabies is to prevent it at its animal source, because More than 95% of human rabies infections are brought on by dog bites. It is acknowledged that the only way to completely eradicate the disease in endemic places is to vaccinate 70% at the at-risk canine population. Nowadays, on 6 June 2023 in Jakarta News, the government has issued a warning against the danger of rabies infection in humans, which has killed nearly a dozen people this year and made an uptick in the number of rabid dog bite cases that have been blamed on coronavirus pandemic-induced disruption to animal vaccination campaigns. The Health Ministry recorded 1,000 cases of people who had been bitten by suspected rabid animals, mostly dogs, up until April of this year. Of that number, some 23,000 people immediately received anti-rabies shots, while 11 had died. Most of these cases were reported in Bali, East Nusa Tenggara, NTT, and South Sulawesi. Last year, there were 104,000 cases of people who were bitten by rabid animals, resulting in 102 deaths from rabies, the highest in the past few years. The number of deaths from rabid animal bites last year almost doubled from 2021, when people mostly stayed home during the height of the COVID-19 pandemic. Feline sporotrichosis. The organism Sporotrix shinki, which is found on wood, flora, and soil, is the cause of the sporadic chronic disease known as sporotrichosis. Because the signs of sporotrichosis in cats are similar to those of other cutaneous disorders, this disease is challenging to identify. As a result, your veterinarian will want to review your cat's medical history and ask you a number of questions regarding the cat's recent behaviors to start the diagnosis procedure. The veterinarian's diagnosis will be made by recent cat bites, outside exposure, and contact with composing materials such as garden compost. Your veterinarian will want to carry out a differential diagnosis to rule out any fertility disorders that might be causing the skin lesions. The vet will first want to rule out the potential of a medication eruption, parasite allergy, immune-mediated disease, or a bacterial pyoderma before he can attribute your cat's condition to sporotrichosis infection. Sporo is frequently linked to a condition that can kill pets, particularly cats. Cats with sporo disease, also called Sporotrix bacillus infection, frequently develop sores on their face, which typically appear around the nose. Only 2 months after the sporo infection, symptoms like swelling and blisters become apparent. If quick medical attention is not sought, the lymph nodes and this ball may both enlarge. In fact, it will worsen by spreading to the lungs and other parts of the body, ultimately leading to death. A lump of skin that ranges in the whole from pink to particularly purple is the initial signs of sporotrichosis. Usually, these tumors feel soft rather than painful. It may also form balls or open wounds that disappear. These lumps and balls will develop into chronic conditions and may take years to clear out if untreated. Usually, these tumors feel soft rather than painful. That's all for me. Thank you. Move to the next presenter.
So, how does companion animal zoonosis spread? Together with me, FAZLYNA and ZUHARI, metric number 065617, let's discuss about it. So, companion animal zoonosis actually can spread by both direct and indirect contact. For example, through direct contact through bites and scratches when they play, or because of the intimate interaction with pets, like sometimes they sleep in beds with the owners, not to mention the face licking. This might seem cute, but it can bring unexpected diseases to the owners. They also can spread through indirect contact, such as when we touch a contaminated surface, since they are in our house. Right. Through these mechanisms, companion animals are a potential source for many human diseases. The percentage of human disease that can be attributed to pets remain unknown and likely underestimated. However, exposure to pets has been linked to a number of diseases, including bacterial diseases like Bartonella species that often includes fever in patients with competent immune systems. More severe diseases like lesions on the skin can occur in high-risk patients, and the reservoir is cats that occur from their scratch. Because the claws can become contaminated with feces from infected places, Next, parasitic diseases, which is Toxoplasma gondii. Toxoplasmosis is a greatest concern in previously non-immune pregnant women and immunocompromised patients, regardless of exposure status. Encephalitis and meningitis can occur. Cat serves as definitive host. However, food and the environment are the main sources of infection for humans. Next, other than that, dermatophytes from fungi and some viral pathogens. Although bats do not typically directly transmit arthropod-borne diseases to people like anaplasmosis, they do bring the zoonotic disease vectors like ticks and fleas in close proximity to people, potentially increasing the high disease risk. Additional surveys suggest that the public in general, and even people with a weakened immune system that has a higher risk of getting diseases from animals, also unaware of the high risk that they are exposed to when being with animals. Sometimes, after diagnosed with high-risk diseases, they get bad. Well, it's not surprising because studies show that physicians do not frequently ask about pet contact, nor do they discuss the risk of zoonotic diseases with patients, regardless of the patient's immune status. That's all from me.
There are a few ways to prevent and reduce zoonotic diseases from spreading. As we all know, zoonotic diseases are type of diseases that can be transmitted from animals to humans and vice versa. Thus, there are a few steps need to take into consideration before we want to hug, kiss or cuddle with our pets at home. Firstly, routine veterinary care like vaccinations, fecal tests and blood tests shouldn't be ignored and must be followed as scheduled. Why vaccinations are important? It is very crucial to protect our pets from life-threatening disease like rabies, leptospirosis and sporotrichosis. All of these diseases can be passed from the animals to humans. Vaccine is also important to boost our pets' immunity towards certain diseases because when unvaccinated pets catch diseases, most of them are fatal. Even if they are able to recover, it will be a long-term problem and can cause more pain to the animals. Next, deworming routine is also as important as vaccinations. Most of the pet owners ignore this routine thinking that their pets do not carry any worms, but almost all of the pets carry worms in their stomachs and intestines. The typical parasites that can be found are tapeworm, roundworm, hookworm, and heartworm. The roundworm will cause significant risk to humans through contact with contaminated soils or pet feces. This is why veterinarians will recommend deworming routine every 3 months. Other than that, flea and ticks preventatives is also as important as vaccinations and deworming routine because they carry and transmit diseases. These species cause diseases through the process of feeding. When they found the feeding spot on the skin, they will grasp the skin and burrow into it. Both fleas and tick-borne diseases can be zoonotic, thus keeping them off from pets is important to maintain pets and humans' health. These preventatives are generally well tolerated by the pets, but label must be read carefully following the veterinarian's prescription to avoid any medication side effects. Next, animal feces contain bacteria parasite eggs that can infect both animals and humans. Many parasites eggs found in feces a few days or few weeks after the animal defecated. For example, after 24 hours, Toxoplasma oocysts in cat's feces will start to become infectious. Before managing the stool, The owner must wear gloves and wash hands well afterwards. The litter box also need to be cleaned to avoid the parasites become infectious. Thus, it is very important to manage and remove feces daily. By doing this, great number of infective parasites present can be reduced. Lastly, washing hands is the simplest step to do, yet the most forgotten one. Many people do not wash their hands whenever they should and do not wash them long enough to kill any germs after touching their animals. Washing hands for a minimum 20 seconds is very important, especially after touching animals, after managing pets' feces, and before handling food. It is a personal hygiene that need to be maintained to prevent spreading of diseases. This is because zoonotic diseases could be transmitted through contact with saliva, urine, feces, or any body fluids from infected animals, including bites and scratches.
First and foremost, regular vet visits are important for vaccination. Vaccinations are a primary method to prevent many zoonotic diseases in pets. This vaccination also helps to prevent transmission of these diseases to humans. Next, regular vet visits can make sure that pets protect against parasites such as fleas, ticks, and worms. Many parasites can carry diseases that zoonotic, meaning they can transmit to humans. Through preventive medication and treatment, vets secure that pets remain free of parasites that pose a risk to both the pet and the owner. Other than that, it is for diagnostic screening. Routine checkups and screening conducted during vet visits can help identify potential health issues in pets. Detecting disease early through blood tests, fecal exams, or urine tests can prevent the transmission of zoonotic disease to humans. For example, identifying and treating a pet with a urinary tract infection early can reduce the risk of transmitting the infection to humans. Hence, veterinarians play a crucial role in educating pet owners about zoonosis and providing preventive measures. They can advise on proper hygiene practices such as hand washing after handling pets or their waste, proper disposal of feces, and basic sanitation. By providing information on zoonosis and promoting good hygiene practice, vet can help pet owner reduce the risk of disease transmission. In addition, vets are knowledgeable about the prevalence and occurrence of zoonotic disease in a local area. Through regular vet visits, they can monitor and track any emerging and prevalent zoonotic disease. By staying informed about disease trends, vet can take appropriate preventive measures such as recommending specific vaccination or providing guidance on avoiding strategies for owners. Apart from preventing companion pet zoonosis, regular vet visits are essential for various other reasons, including overall health assessment. Regular vet visits allow for a true examination of your pet overall health. Vet can assess factors such as weight, dental health, heart and lung function, and mobility. This helps identify any issue or potential health problem early on. Next, vet assess your pet nutritional needs and provides guidance on appropriate diets and feeding practice. This helps to ensure your pet receives the right nutrients and avoid complications such as obesity or malnutrition. On top of that, as pet age, they may require specialized care and additional monitoring. Regular vet visits for senior pet allow for assessment of age-related issues like arthritis, cognitive decline, or organ function. Appropriate intervention and management plan can be developed to enhance their quality of life. Last but not least, vet can provide guidance on behavioral issues and recommended training in human due to behavioral problem.
Thank you to all my group's members who are give excellent explanation on this topic. So, what we can conclude for this topic? In conclusion, companion animal zoonoses were diseases that can be transmitted from the pets to humans, pose a significant health risk. Rabies, Salmonella, Lithopirosis, Toxoplasmosis, and the ringworm are some of the common zoonoses associated with companion animals. Preventing the transmission of these diseases requires responsible pet ownership and the following of the good hygiene standard. Vaccinating pets against disease like the rabies in the courier is preventing their spread to humans. To reduce the risk of illness, regularly hand washing after the handling pets off after cleaning up after them is important. Maintaining good pet hygiene such as keep nails trimmed and avoiding contact between pets and open wounds further reduce the chance of disease transmission. Proper food handling, including cooking meat thoroughly and washing fruit vegetables, is vital to prevent the injection of the harmful bacteria or parasite from the pets. Avoiding contact with wild animals and seeking immediate and find a medical or veterinary attention if exposure to a zoonotic disease is suspected are also crucial steps in the safeguarding the human health. By promoting responsible pet ownership and implementing preventive measures, the risk associated with a companion animal zoonoses can be significantly reduced. Ensuring the well-being of both pets and humans require vigilance and awareness of the disease transmission. By following these guidelines, individuals can continue to enjoy the companionship of the pets while maintaining a safe and healthy environment for themselves and their loved ones. Do you know One Health organization like the World Small Animal Veterinary Association, One Health Commission, and One Health Institute play an important role in detecting companion animal zoonoses? They highlight how human, animal, and environmental health are connected via research, education, and collaboration. By promoting responsible pet ownership, raising awareness about zoonotic disease, and fostering interdisciplinary cooperation, this organization works toward preventing and controlling the transmission of disease from pets to humans. Their work helps make the world safer and better for both people and their beloved pets, which can effectively tackle the problem produced by companion animal zoonoses and protect everyone's health by following the One Health concept. Thank you. See you next video.